The oocyte pickup, also known as egg collection or egg retrieval, is a sterile procedure carried out here in the theater. This could last between 10 to 30 minutes, and this depends on the complexity of the procedure or the number of follicles. At this point, anxiety tends to build up in anticipation for good number of eggs. On the day of egg collection, an informed consent is obtained from the client, and they are also advised to abstain from food nor drink at least 6 hours before the procedure commences. They are also encouraged to refrain from the use of strong deodorants, perfumes, or makeup, as this impacts negatively on the oocyte. She is placed in lithotomy position and her vital signs are checked. In fact, abnormal vital signs such as low or high blood pressure, abnormal pulse rate they are cogent reasons to cancel an already planned egg collection. The client is given some medications to allay anxiety and sedate them consciously to enable them to be cooperative during the procedure. The vaginal wall is cleaned with gauze and normal saline to prevent introduction of infection to the pelvic cavity. The oocyte needle is attached to the transvaginal probe to ensure visualization of the ovaries through the vaginal wall, and with every prick, a needle is introduced to the ovary, to the follicle, to suck out the follicular fluid, which of course contains the oocyte. Oocyte pickup requires expertise and accuracy to avoid injury or failure of the procedure, and also to maximize the chances of the IVF. The aspirated follicle is collected into a collecting tube, which is attached to a suction machine, and it has a pressure of about 120 to 140 millimeter mercury, which should be maintained. High or low pressure affects the quality of the eggs. Our client's well-being are our utmost priority. To that regard, their vital signs are monitored all through the procedure and even after. Following the aspiration of all follicles, the aspirate is handed over to the embryologist to sort. This is a very interesting part of the treatment because everybody comes in handy and everybody contributes to the process. And we also tend to appreciate life at that microscopic level. After the procedure, the client is scanned to ensure there are no form of injuries to the bladder, no form of bleeding, or even bowel perforation in severe cases. They are taken to the room to rest for a while. They are also given medications such as antibiotics to prevent infection, analgesic to reduce the pain from the traumatic process, and also IV fluids.